Good morning, everyone. I'm Dr. Saritha, working as a Chief Consultant Nephrologist in Kamini Hospitals. Today, we are going to discuss about pedal edema and CKD and what are the causes of the pedal edema in chronic kidney disease patient and the symptoms and treatment. So today, in today's session, we'll discuss about mainly the CKD and its association pedal edema, along with the causes, symptoms, and the treatment. So what is meant by chronic kidney disease? Chronic kidney disease is nothing but a continuous failure of the kidneys, and continuous failure, it might be a temporary, it is a permanent damage and deterioration of the kidneys is called chronic kidney disease. Kidneys are the vital organs in our body, and they play important role. They have many roles in the body. One of the thing is it removes the waste material from the body, and it maintains the fluid balance, electrolyte balance, acid-base balance, and it also maintains the mineral balance of the bone tissues. It helps in the production of RBCs from the body. And kidneys, whenever the kidneys are damaged, it loses its capacity to execute these functions. There are 5 stages in the chronic kidney disease. In the first stage of the chronic kidney disease, the kidney is working more than 90%. In stage 2 chronic kidney disease, only 60 to 89% of the kidney is working. In stage 3, 30 to 60% is working. Stage 4, it is 15 to 30%. If the patient is in the stage 5 chronic kidney disease, less than 50% of the kidney is only working. So since kidney has lost its functions, the remaining part of the kidney tries to compensate for the whatever the functions are lost by the damaged kidney. So generally, whenever there is only permanent damage and whenever the kidney function is less than minimum 30% only, the kidney patients will reflect the symptoms. What are the symptoms of chronic kidney disease? It can start with some patients will have the nocturia. That means night times they will be more. And some patients will have swelling of the both limbs, swelling of the legs or facial puffiness. And in the end stages, they will have lack of appetite, nausea, vomiting, sleep problems will be there, mood disturbances will be there. Some patients, final stages, they land up with either severe breathlessness, high blood pressure, and they will have, some patients will land up with even seizures also. So looking into the, in all these symptoms, today we discuss about mainly the pedal edema or swelling of the limbs. So what are the causes of pedal edema in chronic kidney disease? There are 2 reasons for causing pedal edema in the chronic kidney disease. One thing is the patient will lose protein in the urine. So whenever they are losing protein in the urine, the amount of protein in the blood vessels will be reduced. Generally, the protein part will take care of holding the fluid inside the blood vessels. So whenever the protein part is decreased, it means the fluid will come out from the blood vessels and it will be accumulated beneath the subcutaneous tissues, in between the tissues. So it exhibits as pedal edema. And at the same time, whenever the fluid volume decreases, the kidney will sense it like low amount of fluid is being delivered to the kidney. So kidney will compensate for excessive water retention as well as salt retention. And this excess salt and water retention will be reflected as the edema. In the next important cause is impaired kidney function. The amount of working tissue will be decreased. So the leftover kidney is not able to excrete the fluid out of the body. So it also causes the pedal edema. How the pedal edema will be seen? The legs will be swollen, and the patient, from compared to morning, the shoes will become tight, and they feel that their waistband, their belt is also becoming tight. And some patients will have the facial puffiness will also be there, and the skin will be stretchy and shiny. Whenever you are pressing over the limbs, there will be dimpling, the skin will appear. So these are the features of the pedal edema characteristics. So how to control this pedal edema? So best thing is, whatever you are having the chronic kidney disease, you have to concentrate on that. If your chronic kidney disease, if your kidney function is, the kidney function decline is because of diabetes, you have to well control the diabetes. If it is because of hypertension, you have to control that one. Or any glomerular disorders, we have to control the glomerular disorders and we have to take the treatment accordingly. Apart from that, what are the other general measures we have to do to control the pedal edema? First thing is to reduce the salt intake. First and the most important is to reduce salt intake. And whenever you are taking more amount of salt, this salt will, along with the water, it will be retained in the body. So first thing is you have to cut down your regular table salt as well as the processed food. So reduced salt consumption minimizes the edema. And if you are already on tablets, it will help to reduce more of your pedal edema. And the next thing is use of diuretics. Diuretics plays a major role in reducing the pedal edema, but the diuretic should be used with caution and along with the recommendation only by the doctor. Because if you are using too much of diuretics means more amount of fluid will be lost from the body and your BP will drop, and again you will have the other some electrolyte disturbances also. So better be cautious, and the diuretic should be taken along with the doctor's consultation. And the next thing is the compressive stockings. So you have to wear the compressive stockings and use the compressive stockings according to your size of the limbs, and use the correct size of compressive stockings. Some patients will have allergy to these compressive stockings also. And the next thing is the body positioning. Don't keep your legs too much and over the ground, and keep at least if the patient is having pedal edema means keep your legs at least at the level of heart or above the heart, and you have to do it regularly 3 to 4 times a day. And the patient, the people who are working, they will have little trouble with this body positioning posture. But finally, what you have to think is decrease the salt intake, decrease the water intake, good amount of diuretics, compressive stockings, and body positioning can decrease the pedal edema. And along with that, these are the just add-on positions. Main thing is what is the cause of your chronic kidney disease, get the treatment for that. If you are diabetic, you have to take good control of diabetes, hypertension, good control of hypertension, and adequate drugs. And if you are already having a chronic kidney disease component, and you have to get the regular checking by your doctor and follow the prescription whatever they are giving, and don't use the painkillers on over-counter medication. Okay, thank you.